Nausea, broken ribs, pain medicine. Is this any way for a loved one to live the last weeks to months of their life? Many patients going into the end stages of their life will end up with an incurable disease that will cause them to eventually die. These patients need to be on what's called hospice to make life more comfortable for them and the family members leading into this step, according to the National Comprehensive Cancer Research. Patient care in the end stages of life, however, does not end once the patient has passed, due to the fact that there is surviving family. And surviving family needs to mourn. This is also part of the end of life care, according to Current Medical Diagnosis and Treatments 2018. Many patients suffer when they're not necessary to. They're not going to be cured. They're not going to get better. However, we want to hold on to them and savor every last moment that we have with them. We need to be better at understanding when the time comes for a family member or loved one to die and how to treat it properly. To do this, we'll talk about a few things. For one, we're going to talk about noticing the signs and the inevitability that one is going to need to be placed on hospice for end-of-life care. We're going to talk about the options that are afforded to us in this moment, and we're going to talk about the healthcare side of it. It includes the physicians and the improvements to hospice that can be made in the future. First off, we'll talk about the signs that a loved one has an incurable disease or is at their time of death. In this moment, the only thing that really comes to mind at first is cancer. Cancer is very common nowadays, and there's two kinds. There's metastatic cancer, which has spread to multiple organs, and there is treatable cancer, sometimes in one organ that can be treated with surgery or chemotherapy. Chemotherapy, however, has great side effects. Side effects that include weight loss, they include hair loss, decreased organ function, nausea, vomiting, and sometimes chemotherapy can be very harsh on the body. Doing chemotherapy to a patient who's not going to get any better is only going to be causing greater pain to them when not necessary. Secondly, we're going to talk about patients' living will and their wants. This is up to the doctor. The doctor needs to respect their will, if they have one, and their wants on treatment. Living will detail exactly what they want done to preserve their life. Sometimes they will set limits that they want certain surgeries and set limits that they don't want other surgeries. At the same time, it is up to the doctor to make sure that the family does not go against the patient's will if they cannot speak at that time. Next thing we're going to talk about is the options that are afforded now that we know what can cause someone to be at the end of their life and the signs that come with it. The options that are afforded can be broken down into two different ways. There's long-term and short-term care. Long-term care is anyone who can live up to or less than 6 months, and that's the definition that's given according to the CDC. However, short-term care sometimes can be days to weeks, maybe even less. Sometimes these people are in intense care in a hospital and they're not getting better and they're not going to get better. According to Aging Care, 1.3 million people are in hospice as of the year 2013. And with the baby boomers getting older as time goes on, we are to see this number increase due to the rise in population of elderly people in the United States. Next, we're going to talk about the full code status and the DNR status that a patient can be while they're on short-term and long-term hospice care. While they're on this care, there's such thing called DNR. It's called Do Not Resuscitate. This will stop a patient from having CPR performed on them. However, a DNR may have, say, hip surgery to decrease pain in their last times of life. While a full code is going to have CPR, they're going to maybe have a breathing tube or a feeding tube to keep them alive. This full code status is very useful for someone who will live a full healthy life following such events. However, if CPR is done or a feeding tube is put in, this patient may never be able to eat on their own again due to the fact that their body will not respond back from it. CPR will also do something along the lines of break ribs and will cause great pain in someone who does not need any more pain to be given to them. Now that we've talked about a few things that go with patient care when it comes to hospice, we talked about the options given to them, and we've talked about the full code and DNR status. We're going to talk about the educational side of it, that is the improving hospice care. For one, we're going to talk about physicians. Physicians have a responsibility to make this process comfortable for the patient and the family, and to do no harm to any patient that is in the situation. For a patient that has a family that is by their side, there is teaching that has to be performed. The physician must properly teach the family that certain things are going to be better for this patient, certain things are going to be detrimental to what quality of life they still have. That being said, the doctor, in this case the physician, has to respect the patient's wishes, even if it is against the family's wills, but however, they also have to treat the patient to make their life as comfortable as possible. Improvements to hospice can still, however, be made. Hospice care is not just at a facility anymore, it's not just at a hospital. It can be performed at house, and the patient's house around their loved ones, where they feel most comfortable. This, however, needs to be an improvement to the way home medicines are delivered. We now have services that will deliver home medicines to a patient's house via nurse, medical assistants of sorts, so that they can live comfortably for the remaining of their life. Also, we need to talk about the responsive time that we have when it comes to spotting a patient that needs hospice care. It is up to the physician to see these signs that come up to end of life. Symptoms that come with skin modeling for a patient that is no longer healing properly, or a patient that has multiple organ failures that is not being reversed. These are opportunities that the doctor has to make hospice quicker and make the patient much more comfortable in their last days of their life. In conclusion, we've talked about a few things. We talked about patient care and noting when that this patient needs to be on hospice, the options afforded to a patient and family in this situation, and we talked about the healthcare side of it on how we're going to improve hospice care and how we're going to detect hospice care necessary quicker. Don't let a loved one suffer any longer than they have to. Learn and know what needs to be done when the end of life comes and hospice is time to take over.